BCEN test prep exam en Espanol. Question 1. Priapism is a urological emergency characterized by Option A. Painful, prolonged erection. Option B. Inability to void. Option C. Testicular torsion. Option D. A scrotal edema. The correct answer is option A. Painful, prolonged erection. Question 2. Meningitis is an inflammation of the Option A. A brain parenchyma. Option B. Meninges covering the brain and spinal cord. Option C. Peripheral nerves. Option D. A ventricles of the brain. The correct answer is option B. Meninges covering the brain and spinal cord. Question 3. A patient with a history of atrial fibrillation who is not on anticoagulation presents with acute onset right leg pain, pallor, and absent pulses. The nurse suspects Option A. Deep vein thrombosis. Option B. Acute arterial occlusion. Option C. Cellulitis. Option D. Compartment syndrome. The correct answer is option B. Acute arterial occlusion. Stressed about your BCEN exam? We can take BCEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. To calculate cerebral perfusion pressure, CPP, the nurse needs to know Option A. Heart rate and blood pressure. Option B. Mean arterial pressure, MAP, and intracranial pressure, ICP. Option C. Respiratory rate and oxygen saturation. Option D is central venous pressure and cardiac output. The correct answer is option B. Mean arterial pressure, MAP, and intracranial pressure, ICP. Question 5. A Cals fracture involves the Option A. Proximal humerus. Option B. Distal radius. Option C. Femoral neck. Option D. Tibial plateau. The correct answer is option B. Distal radius. Question 6. A positive Koenig's sign is suggestive of Option A. A cerebral aneurysm. Option B. Subdural hematoma. Option C. Meningeal irritation. Option D. Cerebellar stroke. The correct answer is option C. Meningeal irritation. Question 7. A patient presents with sudden onset worst headache of my life. The nurse's first priority is Option A. Administer pain medication. Option B. Perform a complete neurological assessment. Option C. Prepare for lumbar puncture. Option D. Obtain a non-contrast CT scan of the head. The correct answer is option D. Obtain a non-contrast CT scan of the head. Question 8. The antidote for benzodiazepine overdose is Option A. Naloxone. Option B. Flumazenol. Option C. N-acetylcysteine. Option D. Atropine. The correct answer is option B. Flumazenol. Are you looking for BCEN exam actual questions? Visit our website pokerexams.com to access BCEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get BCEN exam answer key today. Question 9. The clinical finding that differentiates a massive hemothorax from a simple pneumothorax is Option A. Absent breath sounds. Option B. A dullness to percussion on the affected side. Option C. A tracheal deviation. Option D. Subcutaneous emphysema. The correct answer is option B. Dullness to percussion on the affected side. Question 10. A patient with a traumatic brain injury exhibits decerebrate posturing. This indicates Option A. A damage above the midbrain. Option B. A damage at or below the midbrain/brainstem. Option C. Damage to the cerebral cortex. Option D. A positive outcome. The correct answer is option B. Damage at or below the midbrain/brainstem. Question 11. A patient experiencing a tonic-clonic seizure is in the emergency department. What is the priority intervention? Option A. Restrain the patient firmly. Option B. Insert a bite block. Option C. Maintain airway and administer benzodiazepines as ordered. Option D. Obtain a STAT CT scan. The correct answer is option C. Maintain airway and administer benzodiazepines as ordered. Question 12. A trauma patient with significant blood loss is in decompensated hemorrhagic shock. Which finding would the nurse expect to see last, as a very late sign? Option A, tachycardia. Option B, narrowed pulse pressure. Option C, hypotension. Option D, tachypnea. The correct answer is option C, hypotension. Question 13. The golden hour for acute ischemic stroke refers to the window for option A, completion of an MRI. Option B, administration of 4 thrombolytics, TPA. Option C, achievement of blood pressure control. Option D, initiation of physical therapy. The correct answer is option B, administration of 4 thrombolytics, TPA. Question 14. A patient presents with a painful, red eye, cloudy cornea, fixed mid-dilated pupil, and increased intraocular pressure. The nurse suspects option A, open-angle glaucoma. Option B, acute angle-closure glaucoma. Option C, a conjunctivitis. Option D, uveitis. The correct answer is option B, acute angle-closure glaucoma. Question 15. In the Emergency Severity Index (ESI) 5- level triage system, a patient who is confused, lethargic, and has a respiratory rate of 8 would be classified as option A, TSI level 1. Option B, TSI level 2. Option C, TSI level 3. Option D, TSI level 4. The correct answer is option A, ESI level 1. Question 16. A patient with a Glasgow Coma Scale score of 8 requires what immediate intervention? Option A, pain medication. Option B, intravenous fluids only. Option C, the immediate endotracheal intubation. Option D, a neurological reassessment in 15 minutes. The correct answer is option C, immediate endotracheal intubation. Question 17. A patient with a spinal cord injury at T1 is bradycardic and hypotensive. This is characteristic of option A, hemorrhagic shock. Option B, cardiogenic shock. Option C, neurogenic shock. Option D, septic shock. The correct answer is option C, neurogenic shock. Question 18. A patient with anaphylaxis develops acute respiratory distress, wheezing, and hypotension. What is the priority medication to administer? Option A, albuterol nebulizer. Option B, intravenous diphenhydramine. Option C, intravenous corticosteroids. Option D, intramuscular epinephrine. The correct answer is option D, intramuscular epinephrine. Stressed about your ESN exam? We can take ESN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient presents with tearing chest pain radiating to the back. Blood pressure in the right arm is 190/100 mmHg and in the left arm is 130/80 mmHg. The chest X-ray shows a widened mediastinum. The nurse suspects option A, acute myocardial infarction. Option B, thoracic aortic dissection. Option C, pulmonary embolism. Option D, tension pneumothorax. The correct answer is option B, thoracic aortic dissection. Question 20. A patient with a pulmonary embolism is at highest risk for which immediate complication? Option A, pulmonary fibrosis. Option B, right ventricular failure. Option C, left ventricular hypertrophy. Option D, atelectasis. The correct answer is option B, right ventricular failure. Question 21. A patient leaving against medical advice, AMA, must be informed of option A, they cannot ever return to this hospital. Option B, their bill will be sent to collections. Option C, the risks and potential consequences of leaving. Option D, the police will be called. The correct answer is option C, the risks and potential consequences of leaving. Question 22. A patient presents with sudden onset pleuritic chest pain and shortness of breath. The nurse notes decreased breath sounds on the right, tracheal deviation to the left, and hyperresonance to percussion on the right. The priority intervention is option A, obtain a stat chest X-ray. Option B, a needle decompression at the right second intercostal space. Option C, administer albuterol nebulizer. Option D, prepare for intubation. The correct answer is option B, needle decompression at the right second intercostal space. Question 23. Which assessment finding is consistent with a flail chest? Option A, a crepitus over the sternum. Option B, paradoxical chest wall movement. Option C, a tracheal deviation. Option D, subcutaneous emphysema. The correct answer is option B, paradoxical chest wall movement. Question 24. A patient with an acute myocardial infarction develops a new holosystolic murmur at the apex that radiates to the axilla. The nurse suspects which complication? Option A, a ventricular septal rupture. Option B, papillary muscle rupture with mitral regurgitation. Option C, pericarditis. Option D, aortic dissection. The correct answer is option B, papillary muscle rupture with mitral regurgitation. Question 25. What is the classic sign of a basilar skull fracture? Option A, Battle's sign, mastoid ecchymosis. Option B, rhinorrhea with glucose minus negative fluid. Option C, hemotympanum. Option D, all of the above. The correct answer is option D, all of the above.